I now call remotely the member for Mildura.
Thank you, Speaker. I rise to speak on the Public Health and Wellbeing Amendment Bill. I tried everything to be at Parliament in person. Plans were made and changed. Flights were booked and then cancelled. And in the end, the recommendation for 14-day quarantine made it impossible for me to attend. I'm abundantly aware, and so is my community, that if I can't be physically at Parliament, if I don't leave my COVID-free community to travel to the epicentre of the second wave, then I don't get a vote and my community doesn't get a vote. Some may wonder what's the big deal if Mildura doesn't have the casting vote. The big deal is that my vote holds enormous symbolism for my community, a community that's experiencing a gaping trust deficit with its state government. They don't want a registered opinion. They want a vote. Whether it's the casting vote is irrelevant. It's a matter of principle to them. And that's the position I'm placed in as a regional independent. I can choose my health or my job. My community can be safe or it can be represented. I was willing to accept that sacrifice in the first wave, and my community was willing to accept it in the first wave. In the first wave, my community trusted the government and it did everything it was asked. The greatest asset we had as a state against the coronavirus was the widespread willingness of our community to comply with the rules. And we had this because of trust. We trusted that the government had our backs. Our community accepted the state of emergency. It accepted the sweeping powers it gave. It accepted the democratic checks that it took away. It accepted cancellations of Parliament, and it accepted my decisions not to attend. It wasn't easy. The longer the restrictions, the harder the task. Cracks in the community's resolve started to show with Anzac Day and Mother's Day, those restrictions on those days. But generally, people willingly stayed the course and we started to turn a corner. Community sport was given the green light. South Australia was making noises about easing restrictions on the border. The first wave ended just in time with trust intact. Trust intact because the numbers showed the government had done a good job, and trust intact because of a strong sense that the first wave was unavoidable. But the second wave was a very different beast in many ways. Unlike the first wave, the second wave felt avoidable. Therefore, the restrictions felt avoidable and the border closures felt avoidable. This made it much harder to bear. The cracks in community trust opened up. We fought hard for a tailored approach to the second round of lockdowns, and I acknowledge that the government tried. Melbourne was ring-fenced to protect the regions, but bigger troubles were brewing on the borders. South Australia backed away from its plans to reopen. Families who had been counting down days to July 21st to be reunited with loved ones were unceremoniously told to wait indefinitely. Then the unthinkable happened. New South Wales closed its border. It was like a line being drawn down Bourke Street and being told to make it work. There was an information vacuum for days and people were panicking. Cross-border residents could access New South Wales, but Army and Air Force personnel would be checking permits and cross-checking against licences. Toddlers needed permits too. And I found this out the hard way on one attempt to visit relatives across the border. Next, South Australia strengthened its border controls. Soon after that, New South Wales announced its hard border closure. Then South Australia announced theirs, and the consequences have not been insignificant. Cancer treatments have gone unfinished, vital surgeries have been delayed, causing pain and loss of income. University students have had to be deferred, throwing the lives of young people into chaos. Communities have been torn in two. Despite residents of Murrayville wearing masks and being COVID tested every 7 days, they were denied entry to South Australia for any purpose, including food, fuel and medical supplies. The local AMBO was told he would have to wait 3 weeks for a permit to cross with sick patients. The next nearest hospital, equivalent hospital, was 220 kilometres away. Yesterday morning, that ambulance crew had to sit on the side of the Mallee Highway for half an hour with a sick 4-month-old baby and his frantic parents until someone, presumably from SA Health, gave them the green light to cross. Murrayville was also without fuel. 3 governments had at least a week's notice to help them. We tried desperately in increasingly heated conversations with ministers and staffers to get help on the border, and no one came through. In the end, it was the local citizens who carried the risk and responsibility of setting up a makeshift fuel depot. The same town that sent CFA crews to the fires in East Gippsland, where virtual cities were set up overnight. In Murrayville's hour of need, there was nothing. Against that backdrop, my community is in no mood to cooperate with the government. I'm not raising these issues to be difficult. I'm not doing it to play politics or to grandstand. I know there is no rule book for managing a pandemic, and that this virus is unforgiving. One decision made quickly under pressure can have significant knock-on effects that can be difficult to foresee without the benefit of hindsight. I understand that. But the impact of the second wave on my community deserves to be known, and my community wants it on the historical record. It is especially important given they don't have the dignity, even symbolically, of a vote in the Parliament today because it's not safe enough for their MP to attend. And we need a way out. Sunday's roadmap will likely contain practical steps and measures, but we also need a plan to address the trust deficit. We need a roadmap for that. We know it's possible to regain trust. In August last year, the government made up for 20 years of despair when it announced the return of our base hospital to public management. It made heroes of the Andrews government. I joked that day that the Premier and Health Minister were the local equivalents of Jay-Z and Beyonce, and it was true. Governments can make heroic comebacks. Governments can restore the faith of a fatigued and frustrated electorate. But the original proposal for a 12-month extension didn't cut it. It failed to address the trust deficit. In my opinion, the 6-month compromise made in the upper house fails to address the trust deficit. I understand that parliamentary process might seem like a distraction to the Chief Health Officer, the department and the ministry. I understand that it is less efficient, certainly in an administrative sense. But in the current circumstances, it's necessary. It's the only way to address the trust deficit, to improve people's faith in the government, to reaffirm we are all in this together, to inspire compliance and ultimately to make us all safer. In my opinion, fixing the trust deficit means not extending the state of emergency for any more than 3 months at a time. Fixing the trust deficit means establishing a committee formed jointly from both houses of Parliament to provide independent oversight of the government's management of the emergency in real time. Fixing the trust deficit means doing what's necessary to ensure rural and regional MPs can vote remotely. In my opinion, measures like these will make the job of governing through difficult and extreme times easier, not just now, but in the future. The bill as it stands, in my opinion, represents a missed opportunity, and for that reason, I do not support it. Thank you.